Are you aware that mysterious itching in particular locations could be your organism's subtle alert regarding cancer? Many individuals dismiss occasional minor itching, but for senior individuals, particularly those past the age of 60, pruritus in highly distinct zones could signify something beyond simple skin dryness or annoyance. It could be your system issuing a sign that you should not disregard. Within this presentation, I intend to reveal 5 highly particular itchy locations on the physique that might suggest cancer, occasionally months prior to any other manifestation arising. These are not arbitrary sensations of itchiness. They represent patterns that medical professionals have repeatedly observed in individuals subsequently diagnosed with grave illnesses, such as lymphoma, pancreatic cancer, and even breast or skin cancer. Continue watching with me until the conclusion because I am not merely enumerating anatomical regions. You will understand the underlying cause for each, the reason these zones itch, the cancers associated with them, and the method to distinguish between a transient skin problem and a more significant concern. You will depart with knowledge of what to monitor, which inquiries to pose to your physician, and what measures to implement if any of these indicators resonate with your experience. Crucially, this information is not intended to induce alarm. It concerns being observant, as the sooner you detect these subtle indicators, the greater your prospect of addressing an issue before its treatment becomes more challenging. Let us commence. The first indicator, unremitting pruritus on the lower extremities. When senior individuals begin to encounter a continuous itch on their lower legs, particularly on the shins and calves, without any rash, dryness, or identifiable new soap or lotion as the cause, it can be simple to attribute it to the aging process of the skin. However, this highly particular symptom has subtly manifested in numerous individuals diagnosed with hematological malignancies, notably lymphoma. This is not an intermittent type of itch. It persists. Frequently, it intensifies during the night and fails to react to lotion in the manner that dry skin typically does. The underlying cause relates to the way cancers such as Hodgkin's lymphoma impact the immune system. These malignancies arise in the lymphatic system, an essential component of the body's protective and fluid removal mechanisms. As the cancerous cells proliferate, they discharge inflammatory substances into the circulation. Furthermore, one of the most frequent consequences of these substances is a profound, almost searing itch that localizes in the lower extremities. Despite the skin potentially appearing entirely unremarkable externally, the underlying nerves are being aggravated internally. There's a gentleman named George, 75, who recounted his experience at a standard cancer awareness function. He stated that his sole symptom for close to 6 months was an unmanageable itch on the anterior aspect of his legs. His physician initially suspected eczema or perhaps an allergic response to detergent. However, when hematological tests indicated anomalous white blood cell counts and subsequent imaging disclosed enlarged lymph nodes in his thoracic cavity, the diagnosis was confirmed. The pruritus manifested initially, he reported, well in advance of any other signs. This type of account is not uncommon. And although not all instances of itchy legs signify cancer, the crucial distinction rests in the skin's reaction or lack thereof. Should there be no rash, no recent change in soap, no insect bites, and the condition has persisted for weeks, it is advisable to investigate further, particularly if accompanied by other subtle indicators such as nocturnal sweating, tiredness, or inexplicable weight reduction. For senior individuals, this level of attentiveness is particularly vital. With advancing age, our bodies convey distress signals in a less conspicuous manner. Pain may not be an immediate symptom. Masses might be situated too profoundly to be palpable, yet the nerves continue to respond. An itch, especially a profound, agitating, and unyielding one, frequently represents the initial manifestation of that response. If you or an individual you are concerned about has been incessantly scratching their legs nightly, using creams without alleviation, and questioning the lack of efficacy, do not disregard it. Consult a physician. Inquire about blood tests. Describe the pattern, because at times the body communicates subtly long before it does so overtly, and attentiveness can be pivotal. The second indicator, pruritus, situated between the scapulae or in the upper dorsal region. A particular type of itch manifests profoundly in the upper back, precisely between the shoulder blades, which is frequently disregarded or attributed to posture, arid atmosphere, or even an irritating clothing label. However, for numerous senior individuals, unremitting pruritus in this precise location, particularly when it seems to emanate from beneath the skin's surface, has been associated with pancreatic cancer. Moreover, the peculiar aspect is that it frequently emerges months prior to the onset of any discernible pain or gastrointestinal symptoms. The linkage may appear peculiar initially. How could an internal organ such as the pancreas induce pruritus high up on the dorsal area? However, this is the mechanism. When tumors in the pancreas start to develop, they can impede the biliary ducts. These are the diminutive conduits that facilitate the passage of bile from the liver to the intestines. When this drainage decelerates or ceases, bile salts commence accumulating in the circulation. Furthermore, one of the initial effects of these surplus bile salts is the irritation of nerve endings, frequently in regions such as the back, where the body possesses a concentrated array of sensory nerves. I recall a lady named Linda, 70, who informed me about experiencing what she termed a phantom itch on her upper back. She would awaken nightly, scratching the area. No remedy provided relief, not lotions, back scratchers, nor even replacing her mattress. She described the sensation as originating internally. Upon undergoing blood tests for fatigue unrelated to this, her liver enzyme levels were found to be elevated. This prompted imaging examinations, which ultimately revealed a small tumor in her pancreas impinging on the bile duct. The alarming aspect was that this itch constituted her sole genuine symptom. She experienced no pain, no jaundice, merely a profound, persistent sensation she was unable to dispel. The sole reason for its early detection was her decision to voice her concern, even when it seemed like a minor issue. This explains the significance of that particular region. Generalized pruritus on the back can arise from dryness, pressure, or abrasion. However, if the itch is localized, unremitting, and shows no improvement with dermatological treatments, particularly if you also observe darkened urine, light-colored stools, or fatigue, it could be a more profound indication of an internal issue. The back serves as the communicator, even when the underlying problem resides in the gastrointestinal system. For senior individuals, such nuanced symptoms are readily overlooked. One may not always wish to appear overly alarmed, but your organism possesses greater insight than you might realize. And when it repeatedly conveys the same signal, it merits attention, even if it is merely an itch. Should you still be viewing this presentation and deem these observations beneficial, kindly post number 2 in the comment section below to let me know you're here. Furthermore, if you are not yet a subscriber, I encourage you to subscribe and activate the notification bell to ensure you receive all future videos. Your backing enables us to persist in producing quality content designed to enlighten and motivate you. Now let us proceed. The third indicator, pruritus of the scalp lacking visible desquamation or dandruff. An itchy scalp may not seem like a significant concern. Indeed, for numerous senior individuals, it is simple to attribute this to arid air, the aging process of the skin, or a shampoo that is not well tolerated. However, when the pruritus becomes unremitting, particularly in the absence of dandruff, erythema, or desquamation, it can occasionally be an initial indication of a more profound issue occurring subcutaneously, encompassing hematological malignancies such as leukemia or skin cancers impacting the scalp. The distinguishing feature of this itch is its tendency to manifest more as a sensation of tingling, formication, or burning, rather than simple dryness. It might migrate from one location to another, and frequently fails to improve with standard remedies such as anti-dandruff shampoos or hydrating scalp oils. For individuals over the age of 60, these types of sensations can suggest nerve irritation prompted by anomalous immune function. a phenomenon that arises when leukemia cells start to proliferate in the blood and interfere with the body's inflammatory regulation. There was a gentleman named Henry, 73, who reported that his scalp had begun to itch each afternoon. He attempted altering his hair care products, then considered that his headwear might be the cause. Yet, even after changing shampoos and going without a hat, the pruritus persisted. When he ultimately underwent a comprehensive blood analysis for unrelated tiredness, physicians discovered unusually elevated white blood cell levels. A bone marrow biopsy subsequently confirmed early-stage chronic lymphocytic leukemia. His scalp had served as the initial and sole area of his body providing an alert. The particular significance of this lies in the fact that numerous senior individuals already contend with some degree of skin dryness or sensitivity. Consequently, when an issue like an itchy scalp begins to seem commonplace, it is often disregarded. However, the differentiating factor of a cancer-associated itch is its resistance to treatment. No topical cream provides relief. No product alleviates it. It persists, troubles, and frequently seems unrelated to any superficial condition. And although leukemia is not the sole potential issue, skin cancers that arise on the scalp, particularly in zones with diminished hair density, can originate as merely a small, itchy area. At times, it resembles dry skin or a minor protuberance. However, if it continues to itch, especially in a consistent location, and fails to resolve, it warrants examination under appropriate illumination by a dermatologist. Since the scalp is not always straightforward to inspect independently, it is beneficial to request a spouse, caregiver, or hairdresser to examine the area periodically. If you experience an itch that has not subsided for weeks and is unresponsive to your attempts at treatment, that is your cue to investigate more thoroughly. Particularly if you have also been experiencing unusual fatigue, increased bruising, or a general sense of being unwell that you cannot account for. It may seem like a trivial matter, but occasionally it is the minor, persistent issues that convey the most significant information. The fourth indicator, localized pruritus on the thoracic or mammary region. When senior individuals, notably women, but also men, observe unremitting itching on the chest or breast region, especially in the vicinity of the nipple or directly inferior to the breast, it can be simple to ascribe this to perspiration, a constricting garment, or even age-associated dermal thinning. However, this particular zone is one of the most frequently neglected locations where pruritus might indicate a substantially more grave condition, including inflammatory breast cancer or other subjacent tumors proximate to the thoracic wall. The distinctive characteristic of this indicator is its frequent appearance prior to the development of any palpable mass. The skin may feel warm to the touch, irritated, or constricted. Occasionally, there is an alteration in texture, appearing somewhat coarse, denser than usual, or exhibiting a reddish hue. Yet, with equal frequency, there are no visible changes, only a profound, unremitting itch that seemingly never resolves, irrespective of the cream or lotion used. I remember the account of Ruth, 69, who perceived a peculiar itching sensation in the area of her right breast. She attempted changing her brasiers. She experimented with different laundry detergents. She even abstained from wearing a bra for a period, suspecting friction was the cause, but the pruritus persisted, affecting the same location daily. When she eventually attended a medical examination, her physician observed subtle skin indentation and requested additional investigations. They discovered a small yet aggressive tumor developing near the skin surface, lacking the characteristic spherical mass that most individuals anticipate. This constitutes one of the factors rendering inflammatory breast cancer particularly perilous. It does not invariably adhere to typical patterns. It can resemble a cutaneous eruption. It has the capacity to disseminate rapidly, and the initial symptom is frequently irritation rather than pain. For this reason, vigilance regarding pruritus that remains stationary does not alleviate with moisturizers, and is concentrated in the identical spot day after day is critically important, particularly in the mammary or thoracic region. For males, this can be even more readily overlooked, Male breast cancer is uncommon, yet it occurs and frequently remains undiagnosed because its manifestations do not align with what most men are conditioned to observe. An itchy area near the nipple, a small zone of indurated skin, or a continuous slight ache beneath the pectoral muscle may not appear alarming. But for an individual in their 60s, 70s, or 80s, it warrants more thorough examination. Furthermore, there is additional information. This type of pruritus is not invariably indicative of cancer developing within the breast tissue per se. It can also be instigated by swollen lymph nodes in the axillary region or just inferior to the clavicle, suggesting lymphoma or another proximate malignancy. Therefore, if the pruritus is associated with swelling, increased temperature, or even merely an indistinct sensation of weightiness in the region, do not delay. Prompt identification does not commence with sophisticated medical equipment. It begins with consciousness, with attentiveness, with observing the subtle patterns that appear anomalous. Because while your skin cannot articulate verbally, it can provide signals. And this is one of the most crucial signals that should not be disregarded. Should you still be viewing this presentation and find these observations beneficial, kindly post number 4 in the comment section below to indicate your continued engagement. Additionally, if you are not yet a subscriber, I suggest you subscribe and activate the notification bell so as not to miss any future videos. Your encouragement assists us in persisting with the creation of valuable content to enlighten and motivate you. Now let us continue. The fifth indicator, unremitting pruritus in the anal or genital zone. Few conditions are more discomforting and more frequently disregarded than pruritus in the anal or genital vicinity. It is a sensitive topic, particularly for senior individuals, and numerous people prefer to dismiss it rather than discuss it. However, when this form of pruritus becomes chronic without an apparent etiology such as hygiene issues, infection, or irritation, it might be an attempt by your body to direct your focus to a considerably more grave matter. In certain instances, unremitting itch in this region can be a subtle, early manifestation of anal cancer, vulvar cancer, or even penile cancer. The hazardous nature of this type of itch stems from its frequent masquerade as a trivial issue. Individuals typically presume it is merely dry skin, a response to toilet tissue, minor abrasion from ambulation, or even a consequence of using incontinence products. And in numerous situations, that is indeed the case. However, when it persists for weeks or months, when it recurs despite thorough cleansing, treatment, or moisturization, and when it starts to feel more like a raw or burning sensation rather than a superficial one, it warrants more detailed investigation. A gentleman named Eugene, 76, had been contending with what he believed to be hemorrhoidal irritation for nearly a year. He applied topical creams, modified his diet, and even utilized cold applications, yet the pruritus never completely subsided. Ultimately, a colorectal specialist performed an endoscopic examination and identified a small lesion on the wall of the anal canal. This proved to be an early-stage tumor, a condition that would have progressed silently if he had not heeded his intuition that something was amiss. The same principle applies to women. Vulvar cancer is comparatively uncommon, but its incidence increases after the age of 60, and one of its initial manifestations is a recurrent itch on or proximate to the external genital region. A palpable mass may not be present, but the skin might start to feel coarser, exhibit slight discoloration, or appear thinner than normal. Numerous older women presume it is hormonally related or associated with postmenopausal dryness, and at times this is correct. However, if the pruritus is unyielding, intensifies during the night, and fails to improve with standard treatments, do not disregard it. This anatomical region is densely populated with nerve endings. It possesses a high degree of sensitivity, and consequently, it frequently indicates internal alterations prior to the appearance of more overt symptoms. Regardless of whether it is a modification in skin cells, neural inflammation, or tumefaction in adjacent lymph nodes, chronic pruritus in this area, particularly when unilateral or localized to a small spot, can serve as a warning sign. Nevertheless, most individuals are reluctant to mention it. They are apprehensive about potential embarrassment or concerned about overstating the issue. However, reticence is substantially more perilous than inquisitiveness. Voicing concerns about an itch could potentially result in early diagnosis, improved prognoses, and emotional reassurance. The principal message is, if the pruritus does not resolve, do not presume it is a normal occurrence. Allow a medical professional to conduct an examination. Because identifying an issue early, even one as grave as cancer, frequently begins with observing something minor, something nuanced, and making the decision not to overlook it. Concluding remarks. As I conclude this presentation, I wish to impart one straightforward reality. Your organism is perpetually conveying messages. At times it communicates via pain, on other occasions through tiredness, but frequently it commences with something so minor, so nuanced, that we fail to notice it, such as an unremitting itch that consistently reappears in the same location. The 5 regions I discussed today, the lower extremities, the upper dorsal area, the scalp, the thoracic region, and the genital zone, are not merely arbitrary locations. They are sites where grave internal conditions, encompassing specific cancers, frequently start to issue their initial, subtle alerts. And for senior individuals, developing the ability to heed these signals could represent the distinction between early detection of an issue and allowing it to develop covertly. There is no necessity to exist in a state of apprehension. That is not the objective of this presentation. The purpose is to provide you with agency, to remind you of the importance of your intuition, and to highlight that what appears to be a minor symptom could be your organism requesting assistance. Should any of these indicators resonate with your experience, do not dismiss them. Present them to your physician, initiate a dialogue, because you are entitled to explanations and to emotional tranquility. I appreciate your participation today. We are keen to receive your feedback. Please post a comment below, sharing one piece of knowledge you acquired today and how you intend to apply it in your life. Your perspectives are valuable to us, so please feel free to express them. Reviewing your comments provides us with significant motivation and encouragement. If you found this presentation enjoyable and beneficial, kindly like, subscribe, and disseminate it. Your backing assists us in our ongoing efforts to produce quality content that enlightens and motivates you. Thank you for your viewership, and we anticipate your presence for our subsequent video.